My name is Cassie. I'm going to be your student nurse today. Is that okay with you?
Yes, ma'am.
I've got my instructor with me, but we're going to be giving you medications. Is that okay?
Yes, ma'am.
Okay. Can I check your name and date of birth?
I'm Jackie Foster, 10/30/89.
Okay. And I've seen you got some allergies. What are you allergic to?
Morphine.
Oh goodness, what's that do to you?
It makes me real sick.
Okay, just makes you kind of nauseated and throwing up. Any throat closing, hives, anything like that?
No, ma'am.
Okay, all right. So just kind of some side effects of it. And then you're a fall risk also?
Yes, ma'am.
Okay. All right, well, I'm just going to prepare some of your medications. I'm going to provide privacy, hand hygiene, and I'm going to prepare some of your medicines, okay?
Okay.
All righty. So they said you've been nauseated since you got that pain medicine earlier? Okay, well, I'm going to give you something for that. The doctor's ordered for you to have some Zofran. It's an antiemetic. It helps with that nausea. It'll take a little while, but hopefully we'll get that nausea under control. And also your heparin's due. Your heparin injection that you get a couple of times a day. Just because you're in the bed a lot, it's just kind of to help prevent blood clots from forming in your legs since you're not moving around a lot.
Okay.
Okay, is that all right with you?
That's fine.
Okay, all right. And it's an anticoagulant. It's a blood thinner that I'm going to give you, okay?
Okay.
All right, I'm going to prepare. So I'm going to give her heparin injection, which is a sub-Q injection. My gauge size, I'm going to pick, a lot of times in the hospital setting, you'll see insulin needles used, but that is not appropriate. Insulin is only to be used for insulin. And so I'm going to get her a sub-Q needle, which is a 25 gauge 5-inch needle for my heparin. And I'm going to get me a small syringe to use for that. And I'll have a blunt tip needle that I will draw my medication up with, and then I'll put my syringe on that when I'm done, my new needle. And then I'm going to get for my Zofran, I'm going to get an IM size needle. So right here I have a 22 gauge 1-inch needle, which is good for my IM site. And then I'm going to get me a syringe for that as well. Okay, my first check. I'm going to compare my orders to my EMR. So I'm going to go on here, if you want to come on closer. I'm going to come on my EHR EMR, and I'm going to look at my heparin. I'm going to look at my heparin and compare it from my orders to my EMR. I'm going to do that checking my 6 rights. My right patient, my right dose, my right route, my right medication, my right documentation, and the right time. So both of those check on my orders in my EMR. And then I'm going to go down and find my Zofran on my orders, check the 6 rights again. I'm going to go back to my orders and make sure that my orders and my EMR match. That's my first check of my 6 rights. So both of my 6 rights match up on my heparin and my Zofran. So now I'm going to go back to my MAR. All right, now I'm going to get ready to withdraw my medications. I'm going to pull out my heparin, which is in 4A, drawer 4A. And we'll have a little book on the for it to tell you what drawer everything is in. And then also, I just got it memorized by heart. I'm going to pull out my Zofran, and I'm going to give. I'm going to pull out my Zofran, and I'm going to get ready to prepare my medications. All right, so first I'm going to prepare my heparin. I'm going to, I'll just put my gloves on. So have you had a good day? You been feeling okay? Did you get any rest last night?
A little bit. My children just kept me up a lot.
Oh goodness, did they stay here at the hospital with you?
They came and visited pretty late.
Oh goodness.
You know how they are when they're with their daddies.
That's right. They just come late, stay up late, don't go to bed early. It's like a party. All right. Well, I'm gonna prepare your heparin. So my order is to give her 5,000 units daily, and then per ml, and then it comes in 5,000 per ml. So I'm going to give her 1 ml. So I'm going to clean my vial. I'm going to clean my vial, and then I'm going to draw back to 1 ml of air. I'm going to inject my heparin. And then always make sure the label's facing you. So I'm going to pull back to 1 ml. Okay. I'm going to you don't recap needles ever in the hospital setting, but to take this off, I'm going to swoop and scoop and twist it off. And then I'll discard that in my sharps container. And I'm going to replace it with my 25 5/8 inch needle. Okay, so there's my heparin. I'm also going to label it and put heparin 5,000 units, 1 ml, onto my syringe. And I'm going to put that right here beside that. I'm going to prepare both and then I'll scan both before I give them to the patient. All right, so now I'm going to draw up my Zofran. All right, so my Zofran is labeled 4 milligrams every 6 hours. She hasn't had it since yesterday. It's 2 milligrams per ml, so that I know that I'm going to do 4 divided by 2 milligrams, 2 mLs. So I'm going to draw back to 2. I'm going to clean my vial. Okay, I'm going to inject my pen. I'm going to turn it over where I can see my label. I'm making sure I'm drawing up the correct amount. I got 2 mLs, so 4 milligrams. I'm going to discard of my blunt tip needle, get my IM injection size needle, and twist that on. Okay. Now I'm going to do, as I'm drawing it up, I'm going to do my second check. Right now, I've drawn up 2 mLs for my Zofran. I'm checking now, I'm comparing to what I have to my EMAR. So I drew up, 2 mLs, which is 4 milligrams. I've got the right patient, I've got the right route, I've got the right dose, I've got the right medication, I've got the right time, and I've got my right documentation. So I've checked in my Zofran, compared, making sure that I've gotten the right medication and checked all my routes with that. Now I'm going to verify with my heparin. So I'm going to scroll back up to the top and I'm going to check all my 6 rights again with my heparin. I'm going to compare, and then what do you need to do with heparin as well? I also would let another nurse verify. Miss Daly over here verified that I had 5,000 mLs drawn up into my syringe, which is 1 ml, 5,000 units, 1 ml. Okay, so I've done my second check with my medications. Now I'm going to scan your armband, okay? I cannot document anything into my EMR without scanning your armband, okay, Miss Foster? Okay.
Do you need to know my birthday again too?
You can tell me your birthday, that would be great, yes.
Okay. 10/30/89.
And tell me your full name.
Jackie Foster.
Okay, thank you. All right, so I've scanned your armband. Now I'm going to do my last and final check. I'm going to scan my medications. All right, so I'm going to have my Zofran. And it's my Zofran. We're given, she hasn't refused it. She wants her Zofran. I'm given 4 milligrams, or either 2 mLs. You can put 2 mLs or 4 milligrams. We'll put 2 mLs. I'll have to scroll down, mLs. Okay. I'm going to, where would you like this in your arm?
That's fine.
It's 2 mLs or less, so I can give it to you in your left deltoid or your right deltoid. If it was greater than 2 mLs, I would have to give it in a larger muscle group we're going to talk about in a second. All right, so I'm going to give it to you in your left deltoid. I'm just updating your chart with all your information. Okay, I'm going to go ahead and scan your heparin, and then I'll give them both to you at the same time. All right, I'm checking my 6 rights again, verifying that what I've got, what I'm scanning, and what I've drawn up is the right medication, the right route, the right dose, the right time, the right patient, the right documentation, going through my 6 rights again. All right, so I'm given 1 ml, 5,000 units of heparin. I'm verifying, like I said, all my 6 rights again. I'm gonna give this to you, would you like it in your abdomen? Is that okay with you?
That's
Where do
fine.
they give it to you last? On the right or left side?
Right upper part.
Okay, I'm gonna give it to you in your left lower. We
Okay.
like to rotate sides so you don't get really bruised and sore and have a lot of bruising from that blood thinner.
Okay.
So left lower abdomen. And that's a sub-Q injection. It doesn't go into your muscle, it goes into your subcutaneous tissue. Okay, I've documented all of my things. I've done 3 checks. I've done through all my 6 rights each time, and now I'm preparing to give my medication. Okay, I'm gonna get ready to give you, which one would you like to do first?
It doesn't matter.
Okay, we'll start with the Zofran first to help that nausea kind of get under control.
Okay.
Alright, so it's kind of a big needle, so I kind of just tell you to kind of look the other way. You don't have to, if you look at it, it kind of makes it a little bit worse on you. Alright, I'm going to give it to you in your left deltoid, so I'm going to find her chromium process, which is that bony part on your right here. And I'm going to go to about 2 fingers below her acromion process. And so I found her acromion process, and I'm going to go about 2 fingers, draw an imaginary triangle, and I'm going to give it right there. Okay, we're just going to do it there. All right, so I'm going to clean my site. It's an IM injection, so I'm going to go at what? At 90 degrees. So I'm going to go at 90 degrees. Okay, it's going to be a sting and a burn, okay?
Okay.
All right, 1, 2, 3. A darting motion. I'm going to hold and aspirate. No blood return. If there was blood return, I would remove and start over. I wouldn't return anything. I would just pull out and start completely over. Okay, you're going to hold for 5 to 10 seconds, holding your Z-track. And I'm going to let go all at one time. I'm going to cover up my needle, safety, and I'm going to discard of it in the sharps container. Okay? That should help you with your nausea start to kick in just a little bit, okay?
Okay.
All right, now I'm going to get ready to give you your heparin. If this was, remember the different sizes. If the patient's has a lot of subcutaneous tissue, you give at 90. If the patient's very thin and very frail, then you'll give it at 45 degrees. All right, I've got your heparin. Oh goodness, I'm going to give you your heparin injection. Remember, we're going to give it to you on this left lower side since you had it on that right lower earlier. Okay, I'm going to pinch that skin up, and I'm going to give it at 90 degrees. All right, 1, 2, 3. I don't aspirate with this. I don't massage. I just inject that medication, the heparin, and then I'm going to hold for about 5 to 10 seconds. Keeping my skin pinched up. And then I'm going to let go altogether and withdraw. I'm going to do my safety, put my needle over my, and I'm going to dispose of it in the sharps container. Okay, so we've already been through the deltoid, finding the acromion process, going 2 fingers below, and the injection goes right there. Sub-Q, remember you can give the abdomen, but any subcutaneous part. The fatty parts of the arm, the fatty parts of the, you don't usually use the back, but the back, anywhere you can pull subcutaneous tissue. A lot of patients use the back of the arm for insulin injections. Most of the time for heparin, we would use the abdomen. But you'll see patients use different sites. They rotate different sites for their injections they might do at home. Now I'm going to show you a couple different landmarks on the patient. Thank you, Ms. Foster. You did great. We're finished giving you all of your medications right now. If you need anything else, though, you let me know, okay?
Okay.
If that nausea doesn't get better, we'll get you something else. All right, so the patient also, for check-off purposes, you're going to have to tell me the other landmarks. Even if you get deltoid, you're still going to have to tell me the other landmarks. All right, so I'm going to let you guys just a little bit. Okay? We're going to look inside.
Which side you want me to rush to?
Okay. You can stay right there for a second. All right, so her vastus lateralis, I'm going to find right at her kneecap. Her greater trochanter is kind of my landmark, and it is to the outer side of the leg, is your vastus lateralis. The rectus femoris runs right down pretty much the middle of the thigh. And then that's kind of your landmark. Finding that greater trochanter, and you come across and right above the kneecap, and then you split in the middle. Right there is the rectus femoris, vastus lateralis on the outer side. Mostly where you see a lot of kids get their injections. You will aspirate, you will Z-track for all IMs, but you do not aspirate for vaccines. But it is recommended that you Z-track for all intramuscular injections. It's hard for me not to look at y'all because I'm trying to look at the thing. But all right, let's turn to your side, Miss Foster. Oh, but not without safety. Let somebody let that side go up. Yeah, you got it. Yes, yes. Oh. Okay, Miss Foster, will you roll to just that side? All right, I'm going to find her greater trochanter. So I'm going to put my palm on her greater trochanter. I'm going to put my thumb towards the abdomen. Oh, sorry, I didn't mean to pull your shirt up. I'm going to put my palm towards the my palm on the greater trochanter, my thumb towards the abdomen, and kind of rotate my fingers back a little bit. And then my ventrogluteal will be right there. That's where I would give that injection, right between those fingers, spreading those legs, spreading my fingers right there, and I would give it right there, that injection site. So that is the vastus lateralis, the rectus femoris, the ventrogluteal, and the deltoid. Those are all the injections that you and sites that you have to show us for checkoff purposes. Anything else on your sheet that I was not? Yeah. All right.